I'm pleased to be joined today on Health Beat by Dr. Justin Oltman, an ear, nose, and throat physician at Faith Regional Physician Services in Norfolk. And today we're talking about thyroid surgery. So, Dr. Oltman, what can you tell us about this procedure and when might it be needed?
Yeah, well, thanks for having me today. So I think it's easiest if we just start at the top and think about what the thyroid is.
Okay.
The thyroid is an organ that lives kind of in the lower part of the neck. It has two sides to it, and really it's a master regulator of our entire metabolism. And so oftentimes patients are referred to an ENT to evaluate when there's something called a thyroid nodule, which is where part of the thyroid just kind of grows and forms this discrete part of the thyroid that can be either benign, it can secrete more thyroid hormone, or every once in a while it can be a cancer.
I see.
And so typically to initially evaluate this is we'll perform an ultrasound. If there's a nodule identified, depending on how that nodule looks on the ultrasound, we might have it biopsied.
I see.
And that biopsy is typically done awake and usually with an ultrasound to ensure that the biopsy is getting into the nodule. Those cells are taken from the nodule, sent over to the pathology lab. They look at it under the microscope with a fine-tooth comb, and then they tell us what they're seeing.
I see. What might be one of the things that would lead someone to reach out to you in this regard?
Yeah, and that's usually when it comes to surgery, whether or not there's a nodule that we want to remove, or if the glands, there's also Graves' disease, which we remove a thyroid for. That's an overactive gland that we can't control with medication very well, or if it feels like it's compressing on your neck.
I see. Terrific information.
Absolutely.
Thank you so much for being here today.
Thanks for having me.
You bet. And that's Health Beat, brought to you today by Faith Regional Physician Services.